And it will bankrupt our country. It's not that we can't do health insurance reform to help bring down costs, to help save the system. This bill, this 2,700-page bill, will bankrupt our country. And secondly, Mr. President, I point out that I think this right here is a dangerous experiment. We may have problems in our healthcare system, but we do have the best healthcare system in the world by far. And having a government takeover of healthcare, and I believe that's what this is a dangerous experiment with the best healthcare system in the world that I don't think we should do. So why did I bring this bill today? I'll tell you why I brought it. We have $500 billion in new taxes here over the next 10 years. At a time when our economy is struggling, the last thing we need to do is to be raising taxes on the American people. Secondly, we've got $500 billion worth of Medicare cuts here. I agree with Kent Conrad. We need to deal with the problem of Medicare. But if we're going to deal with the problem with Medicare and find savings in Medicare, why don't we use it to extend the life of the Medicare program, as opposed to spending that $500 billion creating a new entitlement program? But it's not just, Mr. President, the taxes or the Medicare cuts. You've got the individual mandate in here, which I think is unwise, and I too believe is unconstitutional. You've got an employer mandate in here that says that employers, you've got to provide health insurance to the American people, or you're going to pay this tax. It's going to drive up the cost of employment at a time when we have over 10% or near 10% unemployment in America. And beyond that, a lot of employers are going to look at this and say, well, I'll pay the tax, and they're going to dump their employees into the so-called exchange. Because that, in 5 years, every American is going to have to go to the exchange to get their health care. And who's going to design every health care bill offered in the exchange? Under this bill, the federal government's going to design every single health care bill in America within 5 years, once this bill were to pass. I could go on and on and on. Let me just make one other point. I'll save you. For 30 years, we've had a federal law that says that we're not going to have taxpayer funding of abortions. We've had this debate in the House. It was a very serious debate. But in the House spoke. And the House upheld the language we've had in law for 30 years, that there will be no taxpayer funding of abortions. This bill that we have before us, and there was no reference to that issue in your outline, Mr. President, begins for the first time in 30 years, allows for the taxpayer funding of abortions. So, Mr. President, what we've been saying for a long time is, let's scrap the bill. Let's start with a clean sheet of paper on those things that we can agree on. Let's take a step-by-step approach that'll bring down the cost of health insurance in America, because if we bring down the cost of health insurance, we can expand access. Mr. President, I told you the day after, maybe it was the day you were sworn in as president, that I would never say anything outside of the room that I wouldn't say inside the room. I've been patient. I've listened to the debate that's gone on here. But why can't we agree on those insurance reforms that we've talked about? Why can't we come to an agreement on purchasing across state lines? Why can't we do something about the biggest cost driver, which is medical malpractice and the defensive medicine that doctors practice? Let's start with a clean sheet of paper, and we can actually get somewhere, and we can get it into law here in the next several months.
Frankly, it's something that we haven't spoken a lot about lately, and that is a whole bunch of people who just don't have health care. Okay.
By cutting taxes for entrepreneurs, we can then give our workers the security they need. Taxation is evil.
And he said to them, give to Caesar what is Caesar's, and to God what is God's.
President.
Go ahead, Dave.
I've been biding my time throughout this entire meeting. I thank you for inviting us on the issue of medical malpractice. Before I was elected to Congress, I worked in a courtroom. For years, I defended doctors and hospitals, and for years, I sued them on behalf of people who were victims of medical malpractice. So I've sat at both tables in a courtroom. At least many years ago, I think I kind of understood this area of the law better than some. But I listen time and again as our friends on the other side, when they're asked what are the most important things you can do when it comes to our healthcare system in America, the first thing they say is medical malpractice. It's the first thing they say. Today it was the first thing that was said. The point that's been made by the President is if we do believe the Congressional Budget Office, when Orrin Hatch asked them, how much will we save if we implement the Republican plan on medical malpractice from the House, they said $54 billion over 10 years. $5.4 billion a year is a lot of money, except in the context of a $2.5 trillion bill that we pay each year for health care. It represents 1/5 of 1% of the amount of money we spend each year on health care. The Congressional Budget Office said something else. They said, and as you lose accountability for what the doctors and hospitals are doing, more people will die. 4,800 a year, according to the Congressional Budget Office's reference to this study. Now, the Institute of Medicine tells us 98,000 people a year die in America because of medical malpractice. I think there are things that we have put in this bill to change that. Most of you have heard of this Dr. Gawande. We've read him. I've talked to him on the phone. His checklist manifesto is a very basic approach to reducing medical errors, which is what we should be focused on. And I want to say, Mr. President, I think what you and the Secretary have done is the right thing, incentivizing states to find innovative ways to reduce medical errors and reduce those lawsuits that should not be filed. But let me tell you what, limiting the recovery for pain and suffering for someone who is entitled because they're innocent victims to be paid isn't eliminating junk lawsuits. I will tell you that as far as the President's concerned, in his neighborhood there is a great hospital which I will not name, and at this hospital a woman went in for a simple removal of a mole from her face, and under general anesthesia the oxygen caught fire, burning her face. She went through repeated surgeries, scars, and deformity. Her life will never be the same. And you are saying that this innocent woman is only entitled to $250,000 in pain and suffering. I don't think it's fair. Our jury system makes that decision, and the states, 30 of them, have made a decision on what to do. If you were asked in basic question, over the last 20 years, has the number of paid malpractice claims in America doubled or been cut in half? If you listen to most people here, you'd say they must have doubled. No. According to the Kaiser Foundation, they've been cut in half. Oh, but how about the money that's being paid for these malpractice claims? Clearly, that's gone through the roof. No. Between 2003 and 2008, the total amount paid for malpractice claims in America was cut in half, from $8 billion to $4 billion. This is an important issue. I don't dispute it, and I think we have treated it as an important issue. But to make it the overriding issue is to, I think, really trivialize some of the other things that should be part of this conversation. I've been asked to speak about deficit reduction. I will not, other than to say one general thing. When I hear my friend John Boehner say that we have the best health care in the world, I don't dispute it for a moment. If I were sick, this is the country I want to be in, with these doctors, these hospitals, and these medical professionals. But step back for a second and look at who we are in this room. As was said many years ago, the law in its majestic equality forbids both the wealthy and the poor from sleeping under bridges. When it comes to the wealthy and health care, per capita, we're the wealthiest people in America. The Federal Employees Health Benefit Program, administered by the federal government, setting minimum standards for the health insurance that we enjoy as individuals and want for our families, is all we're asking for in this bill for families across America. If you think it's a socialist plot and it's wrong, for goodness sakes, drop out of the Federal Employees Health Benefit Program. But if you think it's good enough for your family, shouldn't our health insurance be good enough for the rest of America? That's what it gets down to. Why have this double standard? Tom Harkin is right. Why do we continue to discriminate against people when we know that each one of us is only one accident or one diagnosis away from being one of those unfortunate few who can't afford or can't find health insurance?
All right.